the meeting order.
Turn off the mute.
Next on the agenda is our invocation, which will be done by Mr. Parman today.
That'd be me. Thank you. Join me in a word of prayer, please. Lord, we come to you this morning with a heavy responsibility of taking care of folks in this county with their mental health needs and issues. And I pray that for wisdom, that you help us to make good decisions that will impact the most people. Help us to be of one mind, give us understanding on things that we don't understand. And we thank you for that. And we just pray that this meeting is honoring to you. And I pray in Jesus' name, amen. You're welcome. Where's everybody?
And next, I'd like to call attention to our mission and vision statements that are presented and written on our agenda today. And then we'll move on to public comment. There will be another opportunity for public comment, but if there's anyone who would like to make a comment at this time, please stand up and state your name and your address and keep your comments to 3 minutes. Is there anyone who would like to make a comment at this time? Thank you.
Denise Newhouse, been a resident my whole life. And after this meeting, we have to go and get my son, who has autism, and move him home. Because the only choice in this county is for him to live in a park. He can't stand shoulder. He would not survive there. And we have called every agency and everywhere trying to find something he can afford with FSI. And he only gets $940. And even if he lives on the street, he could take a beer with him waiting list. And this is absurd. And my son, if we were not taking him to our house again, pictures himself living on the streets in a park, freezing to death. Okay, I think this is horrific. 27 years ago, we adopted him as an infant, and we did to help raise him, and we fought everything. It has not been an easy life for him. But right now, this is just, I'm just horrified and ashamed of him.
Thank you for your comments. And I should have stated at the beginning that we don't reply at the meeting and go back and forth. And when you share from your heart like that, it's hard to not reply, but just know that you will hear back from Lynn, and that is communicated with all of our board members. So thank you very much. Is there anyone else with a comment today? Is there anyone on the line who would like to make a comment today? Patricia, do you see?
No, I've no one indicating as much.
All right, thank you. Then we're moving on to the next item on our agenda, which is the consent items. You'll see there are 3 things today. One of them is consent to approve our agenda for today, and then the minutes from our January meeting. And we did have one change, as you noted, which was highlighted in the minutes from the December meeting that was sent out to you. And we missed that at our last meeting. So we'll like to take those separately today, just because we have 3 things. So looking for a motion to approve the agenda for today.
So moved.
Is there a second?
Or
It's been moved and supported. Is there any further discussion on today's agenda? All in favor, please indicate by saying aye. And opposed, same sign, please. And then reviewing the minutes from our January 23 board meeting, is there a motion to approve those minutes?
moved.
Motion, and is there a second? Second. Thank you. It's been moved and seconded to approve the minutes from our meeting January 23. Is there any further discussion? All in favor, please indicate by saying aye. Aye. Thank you. Unopposed, same sign. Thank you. And then there was just a change in the meeting minutes from December 19. It is highlighted. I was sent to you, probably all of them chance to read it. We simply missed the Cherry Health Scholarship, which will allow members of the community to attend. And so that was the change in the December minutes. Is there a motion to approve those minutes from December 19 as amended?
So moved.
And supported. Is there any further discussion? All in favor of that, please indicate by saying aye.
Aye.
Aye. Same sign. Thank you. And we have a couple of presentations today. So we'll start with the mental health millage. Anna, thank you for helping us continue to understand all of this.
Yeah, thank you for having me. So I'm Anna Bednarik. Some of you know me and some of you might not have met me. I am our program supervisor for integrated care in community development here at CMH. So I oversee a variety of things. One is the mental health millage. So that's why I'm here today. I come every 3 months to talk to you guys about different things that we're doing for the millage. So today, what I wanted to talk through was our grant overview worksheet that we have here. So with the mental health millage, we do have a grant manager who is now overseeing all of the grants that we have, making sure that we're following deadlines, getting reporting done, all the different systems that you have to use for the different grants, being able to use those. So one of the ways that we kind of keep on top of what grants we have is by using this overview tracking sheet. So looking at this right now for FY23, we have about $5.6 million in grants coming in, and those are funded federally through the state and then some foundation funded funding that we receive. The first section that we have here is our state allocated grants that recur annually. So these are grants that we've had for many years, and we anticipate the funding to continue on those grants. This next section down is our competitive annual grants. So these are grants that, like the second two are probably a really good example. Grants that we've had for a long time, but we have to go through a competitive process in order to get them. So the anticipation is they'll recur annually, but we have to go through those competitive processes in order for that funding to come through. The next section is our grants that are awarded with an ability to be renewed. So these are typically our federal grants that are awarded for multi-year time periods. And then when those are up, we're starting to apply or look for renewal opportunities for those programs. So in this section, we've got one that we're actually currently working on an application for through the Bureau of Justice Assistance. That's our COSAP grant. That'll be due at the end of March. And then we're anticipating some other funding for our CCBHC funding or an announcement to be able to apply for some funding for that. Then on the back, we have our one-time awards. So these are one-time only. They won't be offered again. Some of these are through the state, some are through the region, and then we have some foundation funding. So these are through some special projects that would happen. The next section are our pending reviews. So we have 3 applications with the Department of Housing and Urban Development that we're waiting to hear on. And then the Boundary Spanners grant, we actually have heard that we are approved for funding. It's still in pending because we have to submit our final budget and worksheet. So once that's approved finally, then it'll move into the currently funded grant. The next section is just our planned renewals that we have coming up that we're watching for those notices of funding opportunities, and then planned submissions. So the last one is a grant that would most likely be led by the Sheriff's Department, but we're keeping an eye out on it because of that collaboration with mental health. And it's really a planning grant to be able to provide better treatment. So we've got our eyes out for that opportunity to come out hopefully So it's a lot of information that we have to keep track of. So like I said, this is our overview. A lot of what we have. Then we have some more detail to really show what systems we have to use to report on, to apply on, to keep up to date on information. And our reports do, all of that stuff that we're tracking in a little bit more detail.
Yeah.
You have any questions?
So when you gave the title, you didn't include the two planned sections.
No, I did not include the
Proposal
planned,
that are-
planned or the pending review.
Okay,
So when you review like the HUD ones, they don't overlap years.
oh, yeah.
So those ones are just reviewed annually, so I didn't want to include that in our total funding.
Sure.
Yeah, so we've significantly increased our grants that are coming in over the last few years. And it has been a challenge to try and get where we're getting a good tracking system put in place, but I feel like we've really got a good tracking system in place. We're following all the rules and regs for everything that's going on. Yeah, thank you.
And next, anything for you? Services.
Ah,
Hello.
it's nice. It's soothing. You guys just enjoy the. That's better than the fire. We have a fire, it's like a roaring fire. Okay, let's see. Beth, give me 1 second, I want to, well.
And this is also our technical committee, right?
I believe so, yeah. There's just like 3 or 4 slides.
Okay.
Public supervisor for adults with intellectual and developmental disabilities. And I'm just gonna give you a really broad overview of our services. And if you've got questions, more specific information about any part of what I talk about, I'd be glad to come back specifically about it. So our programs generally, the goals are to increase independence, inclusion, and productivity. And for staff, for people that report directly to me, along with a number of contracted providers that we use. The Pam Tenbrink is the sports coordinator supervisor, and we have sports coordinators, sports coordinator aides, and we have a contract with a provider agency that provides independence coordination for us. The role of those sports coordinators is to help people plan their services, put together the annual plan, lead on the services, and then monitor that plan and the services to make sure that they're accomplishing what's supposed to happen in the plan. And that plan is done, like I said, annually at least, but it can be updated during the year as often as it needs to be. John Myers supervises our clinical staff. As you can see, we have a number of different clinicians, nurses, PTs, OTs, speech, behaviorists. We also have social workers that do the annual psychosocial assessment. And we have contract providers too that provide OT speech in that. In residential, as we heard earlier, residential services are really hard right now. Leah Brink is the residential ombudsman who coordinates all of our specialized residential. We have providers in county and out of county. We try and place people in county as much as possible. If there's not a suitable placement here, we do place out of county with the goal of getting them back into Ottawa County as soon as we can. And then Stacy Hamstra is the Home and Community-Based Services and HAB waiver coordinator. She signs people up for the waiver or completes the waiver applications, I should say, that then go to the LRE and then the LRE sends them into the state. She also does all of our service authorizations, and she, like I said, coordinates all of the home and community-based services surveys. Most requested services, this certainly isn't a list of everything that we provide. There is a more thorough list in my 4, but what we do is what we get requested often are community living supports. Those supports can be done in a group or individually. Goal is to increase independence, community participation and inclusion, and productivity. And people can choose to receive those supports from a provider, or they can direct hire their own person through self-direction. In specialized residential, like I said, we've got in-county and out-of-county homes that where they provide personal care as well as community living supports. Respite is another service that's highly requested. It's a service for non-paid caregivers. So in our case, adults that are taking care of other adults with disabilities, and we fund camps, in-home respite, as well as out-of-home respite. Skill building is it's a service to help people get ready for and hire their own staff directly or choose someone from a provider agency. It's typically this is offered in groups, so it's usually done under another agency, but if there is a need for an individual person, then they can hire that directly. And the goal is to work on soft skills. It's not actually working on work skills in terms of completing a task. It's more the soft skills like staying on task, coming back on time from break, getting along with your coworkers, taking direction from a supervisor, those kinds of more soft skills that you need to have in order to be successful at work. It's meant to be a short-term service, not a long-term service that will lead to supported employment, which is a service that we provide support for people while they're working. So these are jobs in the community where people need a little extra help to be successful. And again, they can hire a provider, or they can hire their own staff person directly through self-direction. Current projects that we're working on, we applied and were chosen to be part of the Charting the Life course learning community. We're one of 3 counties in Michigan that are participating, and it is an in-depth deep dive into person-centered planning, learning more techniques about how to really put together a good plan and facilitate a good plan. We've got 5 people that they allowed to be trained, and then after we get through that training, we will train other people, including people served and their parents. We also applied and were chosen to be part of a Partners Advancing Self-Direction project that is led by DDI and the State ARC. There are actually between 15 and 20 people that are involved in that, including CMH staff, of course, parents, staff from the school, representatives from our financial management service, the LRE, and a person with disabilities is also represented on that group. The main purpose is to really streamline our self-direction process, to develop more informational materials, and then to get more people to participate in self-direction. We were also chosen to be part of an outcome-based supported employment project, which is funded by the DD Council, and it provides technical assistance for us to change our payment process for supported employment. Right now, if someone is getting support in their job, we pay the provider an hourly rate. what we're doing, and there's no incentive really for them to back out, which is the purpose of that support, is to be able to back out so the person can be more independent. In this project, the provider will be paid a set amount at the beginning, and as they fade out, they will get a higher hourly wage, so that there is incentive for them to start backing out. There's also incentive payments for them as the person stays in that position over time, so that they're not going to be in a hurry to back out until the person is ready, because then they're going to lose that incentive payment. So our other partner agencies have participated West, and they've had a lot of success. The cost pretty much remains the same as it was in the other model, but the difference they saw was people getting more jobs, increases in hours, and staying in that job longer. So we're hoping to get that up and running in the next month or so. We're putting the final touches on the rate setting right now. The other big project we're involved is led by the Ottawa area ISD, related to transition services, transition from school to adult services. There are some outside consultants leading that. I'm not quite sure where they're from, but they have experience in putting together transition programs. And this is represented by a large group of people too. There's people from MRS on there, the ARC, or CMH, and then from all of the school, people from the school are represented. And the goal there is to educate and inform students and parents about adult services and what's available and the differences between school and adult services, and to develop a more formalized transition planning process, so that by the time a student is ready to graduate or leave school, they already know what their adult services are going to look like, and they'll just be a seamless transition from one to the other. And then the last thing that we're working on is trying to develop more supported independent living. Housing in this county and actually around the state is crazy expensive, but we are working with people trying to find rentals that are more expensive, and some people have actually purchased a condo or a home, and then we work with them to develop the supports that they need to live there. The other thing, in addition to housing, that's difficult, is staffing. So, and I know we're not unique, but we're working with our providers to do whatever we can to help them with that too. So I hope that gives you kind of a high-level overview of what we do and some of the things that we're working on. And where we want to go. If you've got questions, I'd be glad to answer them. Or if you want more specific information on something, I can be glad to come back and talk about it.
Right. Are there any questions for Beth? Any? Thank you.
Okay.
Thank you.
Appreciate it. And then we're moving on to old business. Is there any old business that we need to cover that anyone is aware of? So you were raising your hand.
Yeah, I did too.
I was gonna say, yes. Okay, then we'll move into new business. And the first item is to look at our service contract. Help should help you talk us through these.
Fortunately, it's a smaller grouping. We're a few months away from it being a little bit larger.
Okay, and it's attachment B.
Yeah, so for new faces, my name is Kelly Getzinger. I'm the program coordinator for contracts and training. You'll see me here most of the time. Gina Kim is our contract manager, so I'm not able to join. She'll be here also. We work together, and Gina does all the hard work. And so I brought her along to kind of help fill in any gaps.
In case there's any questions.
Right. So the first contract that we have is ADIA, for those gift and Swahili. We just asked about that because we were trying to make sure we said it correctly. This is a new contract for adult foster care residential facility. They are located in Wyoming, Michigan, that we will have placements at, and this contract is going to be effective 3/1. The next contract is Building Men for Life. This is an amendment to an existing SUD contract. And this is for grant funding through the LRE to establish recovery community organization to help create safe space and sustainable programming for individuals in recovery. And that is slated to start March 7th. Our next contract is Giddings 2. This is a new contract for adult foster care residential facility. And this is for personal care community living supports. And they are located in Kentwood. And that we had a placement that started on February 9th. The next item is Lighthouse Autism Center. This is a new contract for applied behavioral analysis. They are located in Jenison and provide autism services for children. And that is expected to start March 1st. The next is Samaritas. This is an amendment to an existing contract for a substance use disorder contract. And it is to add our family engagement team program for individuals who qualify for women's specialty services and recovery management programs for individuals who present with multiple psychological stressors and co-occurring disorders. And that is a March 1 contract. The next is an amendment to Turning Leaf Residential Rehabilitation Services. This is an overall rate increase for all services. We're also including all of their residential facilities to be included in the contract for easy placement if we have a need for consumer. And services provided are for adults with IDD and MI, and that is a 3/1 change. The last two are the same purpose, Cherry Street Services, doing business as Cherry Health, and CRC Recovery, doing business as Western Michigan Treatment Center. They're both amendments for substance use disorder. There was a mandated increase by the state of Michigan that we have to follow through the Lakeshore Regional Entity for one of our services with them. And that you'll see the data is back to 10/1, and that was part of the mandate from the state of Michigan. That is all we have for you. Any questions?
Thank you, Kelly. Is there a motion?
Hold on, I do have a question. Sorry, I raised my hand here, and it's just a statement. Turning Leaf Residential Rehabilitation Services, is the start date accurate for 3/1/24? Was that meant to be 3/1/23?
Thank you for that. Yeah, it is meant to be 3/1/2023. Thank you.
And is there a motion to approve the service contracts as presented?
Or
Moved and supported to approve the service contracts. Is there any further discussion? Hearing none, all in favor, please.
good job, Gina.
And then our financial report. Looking at attachment C.
So Amy is on the phone. She's in quarantine.
Okay.
And we also have Nick back here who I think can answer questions. Nick, are you taking the lead or is Amy? Okay, okay.
Okay, so I'll be talking about attachment C. We've provided also attachment, is it E with the LRE for reference. Attachment C, and Nick is going to talk about a couple budget adjustments that are defined in attachment D. So we're presenting today the financial status report through the end of January of this year. Starting in the upper left corner, the mental health fund. We're continuing revenues ahead of budget and exceeding expenses at a healthy pace. If you recall, at the end of December, we're still processing some of our fiscal year 22 reporting. And so some of our expenses were kind of slower to catch up to revenues. We're kind of closing that gap now. We're still in a pretty healthy position with, you'll see a net balance of just over 4 million available. So in a good, healthy position with mental health fund, the SUD fund, we're tracking well as well. You'll notice that grants year to date are a little behind, but that's due in part to our we do a quarterly draw, and we were waiting on a few but agreements for grant agreements to be signed. So we haven't done a drawdown yet on some of those grants where the agreements had just been signed at the end of the calendar year, primarily because our expenses weren't, we're still ahead of position, but are moving to do a monthly drawdown to better align the real-time service activity. That's something that we're planning going forward. But again, SUD is in a healthy position. Moving on to the millage and grants, again, a healthy position there. We reported the transfer in for the grant, the board initiative grant for recruitment as an actual revenue transfer in, so it wasn't kind of skewing the expense line. So you can get a better sense of where we're at with the revenues and expenses. You'll see that compared to last month, our year to date for property taxes, as people start paying their taxes, those revenues kind of increase in this first quarter of the calendar year. But again, in a healthy position with millage, and based on some of the comments that Anna had said about a lot of the grants that are housed in the millage fund, a lot of activity, a lot of different things going on in and out of that fund. Within the bottom right corner, again, healthy position where our budgeted Medicaid funding is, actuals are in a good position and ahead of budgeted. So everything's looking on track at this time, and we're just closing out fiscal year 22 numbers. So we'll have more detail on that in the coming month. Any questions on the financial status for January?
Well, I'd like to entertain a motion to approve the January financial report as presented. Moved and supported, guys. Thank you. Is there any further discussion? I especially think of our newer board members. This format all makes sense to you? Okay, thank you. Any other discussion? All in favor, please indicate by saying aye. Carries. Thank you, Amy, for reviewing that with us.
Mm-hmm.
And now we'll look at the budget adjustment number 3, which is attachment D, and here's Nick. Thank you.
Hi, everyone. Hello. If you all haven't met me, I'm Nick. I'm the budget analyst here at CMH. I am presenting today our third budget adjustment of this fiscal year. The attachment B shows all current changes that have been made so far to our budget. And then the amendment summary is what I'll be bringing today. I have first the ARPA treatment amendment for $200,000. This is something that Gina and Kelly spoke about with the Building Meant for Life, as the 150,000 is a large part of this. So this is ARPA funds that are directly from the LRE. They are to be paid to CMH for the purpose of staff time, indirect costs, mileage, phone, office supplies, and materials to the member service area, which is Ottawa County. The second one is an extension for our mental health block grant. That grant was supposed to end on March 30th. The state has since extended it to December 30th. And they're giving us an additional $52,333 to finalize the end of the fiscal year to September 30, which is the end of our fiscal year. And next is the new grant that was mentioned by Anna for the diversion boundary standards. This grant would develop a team dedicated to the coordination and support of justice involved or at-risk individuals with behavioral health conditions. The team would help with diversion, stabilization, and integration of individuals re-entering the community with the long-term goal of reducing re-offense rates. And that's a total of $216,332. The grant is still in the pending stage, but we wanted to make sure that the board was aware. So if it does get approved, we can. And then if these are approved, they will show in the increase decrease category of the following. Right now, they're not included in that if you were looking for those. The current increase decrease categories are all the changes that we've made so far this fiscal year with the previous two amendments.
So looking at attachment D, the
Yep.
amendment summary,
Mhm.
and that is what the total of what we're.
Yep, that's just the total for this one. Everything else that's in the increase and decrease category has already been approved. So that's just where we're at so far with changes of like SUD fund. We had some grants that ended, so that's the reduction there. Additional ones in millage have been added, such as the $1 million from board initiative for the recruitment and retention of physicians within Ottawa County. And then other grants estimating for this year. And then mental health. The only change I know of right offhand is an additional grant that we approved for the incentive for our on-call staff for increasing it.
Thanks for that. Nick,
Mhm.
and is there a motion to approve the budget adjustment?
And I'll support.
Is there any further discussion on that? Okay, all in favor?
Can you repeat again about the ARPA funds?
That is a grant that's directly from the Lakes Regional Entity. And they are providing us $200,000 for SUD treatment from their that is allocated to us to spend our staff and providers within the
State ARPA funds, not county.
Thanks for the clarification. Okay, any other discussion or questions? All in favor, please indicate by saying aye.
Aye.
Thanks, Nick. And then the LRE, looking at the financial statement, which is attachment E, and again, this is just for information only. We just really wanted to look at where we were compared to members of the LRE, and this form has been very helpful. That attachment E, and that one. He's still with us.
He's still with us. Here she is.
Oh, okay. I can't, I'm not sure if you asked me to talk more about this, but the LRE document, it is reporting through the end of the calendar year through December 31. So you'll see the numbers are a little behind what we reported for our January numbers, but You know, kind of just reiterating, we're at a healthy position, still have a surplus. And actually, the actual is that $5 million surplus now in January has been reduced to 4 million. We're kind of tracking to catch up to that. We have a projection that we put together at the beginning of the year that we're kind of holding as a standard projection, feeling good about where we're at with the numbers for the full calendar year, which is that second segment, the projection, which is also in line with our proposed spending plan. Typically, the spending plans would be adjusted maybe quarterly or every 6 months, depending on the CMH and depending on where the projections go monthly. But we're feeling pretty good about keeping those two aligned and don't feel a need to adjust the spending plan at this point. We're kind of tracking to monitor when we close in our expenses to revenues in the actual to see. But this is a new format for reporting, so it kind of lays out the information a little differently than in the past. So if you're kind of familiar with how the LRE reported their regional activity in the past, I think that this kind of lays it out a little better, that we have an obligation to provide some description of the variances. So you'll see for the actual, we have reported that we were still working on the fiscal year 22 expenses for a lot of that first quarter, and we had a 3% increase for SUD expenses that was effective January 1, and a couple other contracts that were starting January 1 that will impact some of the increased expenses to revenues going forward. So I don't know, does anybody have any questions on any of that information?
I wondered, are you using the same coding that we do for the budget where the red is the caution? Or the red is more variance. I just wondered about the red on the variance projected, if that is more the timing. If we
The way the LRE uses the way it's color coded for this report, green is if you're in a surplus position and red is if you're in a deficit position.
Okay.
So, and that's deficit to, you know, from your, it depends on the category. So that first segment is actual. So luckily nobody's in the red. That's a good thing. There's a lot of surplus. For the projections where we're at with, we're projecting a surplus for the year, or if we're just kind of projecting along with our spending plan. And so again, it's positive to have green here in both the projection and the spending plans, because that means we're not anticipating or we don't have a spending plan that puts us in the in a deficit. The very bottom is the variance between what's projected and proposed. So a couple CMHs were, you know, they do have a variance that puts them in a negative position, but overall they're still planning to spend within their revenues. So it's not really spending outside of their revenue. It's just they're reducing their anticipated expenses, and it's causing a variance overall between the projected and the proposed plans.
Thank you.
Could you please tell me who is involved in the Help West Network 180 on point? Because it looks like Ottawa is the only one that goes by county name.
Health West is Muskegon. Network 180 is Kent County, On Point is Allegan, and West Michigan is actually West Michigan CMH, which includes Mason, Oceana, and
So the ones
Lake.
north of,
Mhm.
okay. And then LRE encompasses all of
That's,
them.
those are the CMH members of our region. LRE is Lakeshore Regional Entity, which is the PIHP. Which is,
Yeah.
the prepaid inpatient health.
So if there is a deficit at the LRE, is that made up between the 1, 2, 3, 4, 5, 6 entities or 5 entities?
Yeah, it's reported out by those CMHs, but then
Mhm.
total column on the far right would be for the entire region.
Correct. And so I thought I heard Amy say that they're going to spend within their means, the two that are in red, Network 180 and On Point, or am I inaccurate?
So that variance is just between what they had originally had in their spending plan versus their current monthly projections. So it is something to track and monitor. There are agreements in place, contracted agreements for risk management as far as whose obligation it is to cover, variances. But right now, nobody's in a negative position. They're just projecting that they're projecting a change that might bring it closer to their proposed spending plan.
Okay.
All right. Thank you. Is there any other discussion or any other questions on this? It was helpful to hear you talk us through it with the different reporting format than we had with our other reports. So thank you very much.
And I think the more months that we see it in action, it'll make more sense. Like it's kind of that variance at the bottom, it kind of stands out and makes it look like we're tracking a variance, but it's really just in what we're reporting our anticipated expenses to be. So.
Right. And of course, me representing Ottawa County are looking as part of the LRE. We need to look at the whole, but of course we are pretty focused on our county and just making sure that the revenue that we need to support our residents is stable and remains where it should be. So thank you.
First and foremost. Yep.
Mm-hmm. Okay, and then our next, we're going to look at attachment F, and it is a suggested amendment to authorize Lynn to sign. And yeah, this is something we've gone through similar things, but Lynn, would you be willing to talk us through what this is, and so that everyone is on the same page and understand?
Yeah. So we have the 5th amendment to the Lakeshore Regional Entity, and it's the amendments are often prompted by a change in the contract that occurs between Michigan Department of Health and Human Services and the PHP, and then they push it down. So basically what they do is some other minor changes. So really the biggest changes in here, I don't have any particular concerns with any of the changes. They simply, for Exhibit C, they updated the mandated reports and when they're due. Exhibit D, the amounts of the funding are the same. Moved it to its own agreement. Exhibit F, the specialty grant responsibilities, is deleted and replaced with Exhibit F, and that has that is specific to CCBHC grant funding. That's part of the demonstration, and if you'll recall, 2 of the CMHs in our region are in the state demonstration project, and 3 of the CMHs are in the SAMHSA expansion grant. So the changes in Exhibit F and Exhibit H only pertain to those 2 CMHs that are in the demonstration.
Both West and West Michigan?
Health West and West Michigan.
Yep, okay.
Is there a motion to authorize the to sign the amendment?
So moved.
And supported, is there any further discussion or are there any further questions? All in favor, please indicate.
Aye. Good.
Next on our agenda is our
So from the state perspective, one of the biggest things we're working on is thinking about that unwinding of the public health emergency that required that Medicaid coverage was continuous through the pandemic. Starting in June, DHS will start redetermination, so asking people to reapply to be eligible for Medicaid. This is important to us in particular because, as you know, most of our funding comes from Medicaid, and the way we get that funding is through enrollments of the individuals in Medicaid in the county. So we're definitely paying attention to that. The department and our local DHS office is doing quite a bit of communication to folks who are on Medicaid to let them know that the redetermination process is going to start, and providing some helpful information about what they can do if they're still eligible to make sure that they send in all of their information. So we're going to continue to work with those partners on making sure that our folks in particular who are on Medicaid go through that that process of redetermination and stay on Medicaid if they're eligible. We will definitely see a decrease in Medicaid enrollments. Probably the biggest area is going to be in a Healthy Michigan plan, where Kendra Spanger from our department has told us that the numbers of enrollees in the Healthy Michigan plan are about double what they were prior to the pandemic. So it's hard to tell how many people are going to drop off, but it's likely that's where we'll see the biggest change. You know, in the rate setting process, we are promised that the department through Milliman will address those changes, make us whole. So we'll continue to be hopeful that that truly is the case. And I'll keep you updated. It's going to take an entire year to do the re-enrollment, so we're not going to see a cut off right away. It'll be gradual, but we'll have a better idea of where we're at in 6 months, 12 months. So I'll keep you up to date on that. I did want to let people know, especially new people, that our trade association, the Community Mental Health Association of Michigan, provides training for board members, new and old. And they currently have some training videos available for board members on like the foundations of mental health, public mental health, management, current and future funding for CMHs, budgets, leadership. Those are the videos, some of the videos that are available. So if anyone is interested in viewing those, you can let me know and I can get you connected to those. Another way that you can get that training is to attend one of their conferences. They hold multiple conferences through the year. There's one coming up in the summer, June 6th and 7th, and there are big conferences in the fall, and that's October 23rd and 24th. And they always hold board work sessions to help board members, again, new and old, learn more about how to be a successful board member for CMH. And so if anyone is interested in any of that information or would like to consider going to a future conference, you just have to let myself and Patricia know, and we can get you that information. They're typically, the conferences often are at Grand Traverse Resort, so it's actually a nice kind of getaway. Al has taken advantage of that occasionally, but
I've done it too, Lynn, and found it to be really helpful.
we can help pay for conference for those people who would like us to do that. News from the Lakeshore Regional Entity. I have a little bit of an update on that historic deficit issue that they've been dealing with for the last months to year. They recently had another court appointment. The hearing lasted for a while, an hour and a half, where they were, in the end of that, they were asked to submit a joint glossary defining terms on both sides. They agreed to do that, and that was back February 3rd. And as of 2/16, there were no further updates on where they're at with that ruling, but they hope, I know that LRE hopes to have that resolved as soon as possible. Just a reminder, Ottawa CMH is not impacted by that historic deficit. Some of our other partner CMHs definitely are, but we are cost settled through 2021. So the historic deficit is not going to impact us financially, other than, you know, if the LRE is able to use current funding to address that past historic deficit, that will definitely impact the savings that the region has. And obviously we would be interested in making sure that that was a well thought out process. We don't want to drain the savings because we might need it someday. So I know that there will be further discussion on how if they're successful in being able to use those funds now, there will be quite a bit of dialogue about how those will be sorted out if we're not allowed to use those funds. Obviously, the funding that they have in savings will stay where it's at. So from CMH, I just wanted to remind folks of what our strategic priorities are for this year. They are to preserve core services in the public system, integrated health and care coordination efforts, make sure that we are efficient and accountable, and to provide support to our staff, our provider network, and the people we work with, our consumers. I wanted to thank people for their presentations today. We are planning over the next 6 months to have 1 or 2 presentations from our different departments to get all of the new folks up to speed. So next month, we're planning on family services, including autism, and an update on children's mobile crisis, and QI and UM updates, quality improvement. Anything in particular that you want to hear about, that you'd like to hear more quickly, just let me know and we'll get those people on the schedule. Nick talked a little bit about a new grant that we were notified that we're going to receive. It's called Boundary Spanners. Again, that's through Michigan Department of Health and Human Services. It will allow us to develop a team dedicated to the coordination and support of justice involved in at-risk individuals, with the ultimate goal of reducing recidivism, people going back into jail. We are looking at 3 positions for the grant cycle starts in May, and it's just for the remainder of this fiscal year, so 5 months. And then there will be an opportunity to reapply for future funding. We are looking at that first 5 months, recommending 3 positions. a diversion liaison person, which is a master's level clinician, a community sports specialist, which is a bachelor's level, and then a re-entry recovery coach. So someone with lived experience in substance use disorder to round out that team. It's likely that having being involved in that grant initially for the 5 months, we'll evaluate whether we want to apply for the maximum funding, which is $400,000 a year, and if we need additional positions and how we would use them. Last month, I let you know that we were planning to present several positions to the finance committee. That vote was postponed pending more information, and I've been working with, in particular, Commissioner Cosby to get her additional information, and we'll keep working on that to answer any questions that might be outstanding. We concluded our roundtable discussions on February 14th, and I believe they went very well. We got lots of valuable information from folks. We're putting together some thoughts about how we're going to move forward with some of the recommendations and suggestions. The last meeting, if you'll recall, in an email I sent, I elected to go just in person on that meeting. We had the previous two had call-in opportunities, and it was getting a little bit concerning because there was a clear need for people to want to talk about individuals and individual issues. And I was worried about confidentiality. So we were able to talk to a couple parents individually about their particular issues at that meeting. So I think it wasn't a bad decision to have that one just available just for in person. So the last thing I wanted to talk to you guys about was we have had several organizations recently approach me and ask for additional assistance through our specialized residential financial assistance program. There are folks, one is a new organization that would like some funding through that program. One is an existing participant who is finding themselves in a situation where they're going to be short of funds for this fiscal year. So I'd like to recommend that we consider increasing that millage saving specialized residential program by about $200,000 to address those new requests. We have that money in millage savings, but I'm not asking for approval at this meeting. I'm just letting you know that I will likely come to you in March with a formal request to increase that budget line item. I'm also recommending, and if you're I'm hoping you're interested in exploring this further. We've been approached by several families, several individuals with requests to help with some one-time expenditures, and it's usually housing related. So I'm talking about things like helping to fund one-time security deposit or first month rent type of opportunities for some individuals. Accessibility modifications that aren't covered by any other funding source like Medicaid. The payments, or this, in my opinion, this program would be payments that are last resort. We've explored all other opportunities for funding, and they can't find any other opportunities. And again, it would be really exclusively related to housing purposes or residential types of things. So if you're interested in that, I'm planning to put a formal proposal together to let the board look at and consider. We would have to really clearly identify what was an acceptable proposal, some dollar limits to how much funding could be available per individual, and obviously a budget that would be available for that funding. I think it could be very helpful in helping to resolve some of these issues we're coming against with legitimate requests for help that we really just don't have any other means of helping the individuals with. If you'll recall, millage dollars, when we went after those dollars, were intended to fill gaps, but not replace Medicaid or any other funding source. So I guess I actually am asking just some nodding of heads if you'd like to have me put something, a proposal together, and I can present that in more detail at our next meeting. And that's all I have today.
Okay. Well, that really seems to fit with what we discussed when we started the first time with millage, of looking at that type of gap and how we might be able to use the money for that. I think we would all be great. Okay. Thank you. And then board members, any general information, comments, or meeting attended that you'd like to share? I would just like to share one thing. I'd like to offer the opportunity for any of you who would like to do the invocation at our upcoming meetings. Just let me know. I'd love to have people volunteer for that. Anything else that anyone has? Then we'll move into our second opportunity for public comment. Hi, I'm not sure if you were here when we had the first public comment. Shall I state again if you state your name and address, and would limit your comments to 3 minutes, please. And we generally don't do the back and forth. We take the information from you and respond. Thank you so much for being here.
My name is Randall Dillinger. I live at 600 Ryan Street, apartment 5. Been a client of CMH for 11 years. I came in 2011. Had issues with my mental illness. 8 years ago, I ran into a best friend of mine, who's a very good friend of mine, who's helped me out with my mental illness. 6 years ago, came in, got my shot. I get my shot every 3 months through CMH. See my therapist every 3 months. See my psychiatrist every 3 months. And then I started working at the gym. Anytime Fitness has been there 6 years. Then 6 months ago, I got a job at mobile gas station at Riley and Butternut. So I've come a long way from where I was.
Hey, good job.
Certainly have. Yes. Well, thank you for
Thank you.
sharing.
You're welcome.
Okay.
Mhm.
Any other comments today? And
Rosalie asking for a question.
Go ahead, Rosalie.
On the brochure, it doesn't say about independent facilitation. And there's a few questions about how to access that service. It's supposed to be two services. So I'm just wondering, but how is that? There's confusion between you have to be contracted with CMH and independent facilitator. When we have an independent facilitator through our directly budget, we get our estimates. Which one? How do people access independent facilitation? And so the FSR now is formerly the bucket report, I think. And then Anna's mental health millage, their attachment she passed around with the grants, but it's not in the packet.
We'll put it in the minutes and you can have a copy too.
And I feel like a broken record, finally got aquatic center, but I'm pretty salty about that because they charge a $2 caregiver fee. That's gonna go to the Health and Settlement Fund grant. CMH is okay paying that, but like Heritage Homes, they've already fought the issue. I feel it's an ADA violation. The disability tax, $2 for a caregiver to go to the pool and the girl. Which brings up, I think CMH needs a contracted ADA 504 coordinator. Disability network, Lake Shore has one. If that's a possibility. And, I mean, I don't know. Feel like I'm rambling, but, yeah. That's all I got at this point.
Thank you. Thank you for your comments. Anyone else have any comments today? Is there anyone online with any comments for a public comment today?
I have one. My name is Jewel Wickman.
Okay,
Jewel Wickman, 17577 Ridge Avenue, Spring Lake, Michigan, 49456. I'm looking at the activity report and I was wondering if we could have the Medicaid capitated bucket. If we could have that line itemed out with how much goes to the habilitation waiver, SCDW, children's waiver, it would be very helpful in knowing the people if they knew, if the board knew what funds were allocated in that Medicaid capitated bucket. Because that, what's that, $30 million or 40 million? It's going to be helpful to know where that money's going. Also, as far as the surplus, Ottawa County had a 38% surplus. Why is that? And if the board could please look into the definition of what surplus is in the operating agreement, and if Lynn could possibly put the operating agreement in the next packet, that would be really helpful because a lot of the board's responsibilities are in that operating agreement. As far as transfers, I keep going back to this. One of the staff said there was a $300,000 transfer that saved the organizational budget money by transferring out. I want to know, is that a person? Obviously, a person got transferred that had a price tag of $300,000. I really think that I really ask that the board start looking at the people that they serve and find out, are the transfers and please, are they interregional transfers? Does that mean that in LRE, our people are being transferred back and forth? They're not being out of the state into a psych hospital, but what are happening to the most severe IDD individuals that we serve? And the Michigan Health Grant, what happened to the 133 people when the Michigan Health Grant started for the IDD individuals? It was supposed to decrease the mortality and morbidity rates of the most vulnerable people. And I can't seem to get an answer despite all of my repeated questions. We started with 745 people a year and a half ago. The most recent number we have for IDD is 621. So this grant is meant to decrease mortality rates and morbidity rates. So why are we losing 133 people? And are they dying? What's happening to these most vulnerable children where maybe many of these parents have passed away and these kids are on spend downs? Please look into where these people are going. As far as the CCBHC, I really don't understand why we're spending $500,000 on this, on looking for more full-time employees when we don't even know what the current employees do. If we could please have an org chart with names and roles of what everybody does, that would be super helpful. Also, Ottawa County is not a CCBHC clinic. If you look on michigan.gov, it's Health West or Health Point in Muskegon. And Muskegon is the one that's supposed to serve non-residents as well as residents. So that's our neighboring county that is in charge of the CCBH, that's a certified CCBHC site in the Medicaid provider manual. Also, if we could have, they talked about rate settings, could we please have the current rate settings for DAB, disabled age blind, and TANF for the temporary families, and SUD for substance abuse? I think those are the main categories. It would help the board to know what those numbers are and how much revenue is allocated for each. And also millage, can you supplement that? I don't know if that's legal to supplement what Medicaid is already paid.
You your 3-minute time limit.
Okay, that's.
So we thank you for your comments and we will be in touch with you.
Thank you. And may I ask for one thing? A specialized residential stabilization program? If we could please find out what that is. There's a lot of money going to that, and how many people in our county are actually being served, because we serve other counties
I'm
as well.
going to have to move the meeting along, but thank you very much for your comments.
Thank you.
Welcome. Any other public comments, either here or online? Thank you all. And thank you all for your presence and participation today, and our meeting is adjourned.